We want to talk about this and many other issues that are going on with COVID-19. And we're going to bring into the stream Dr. Ali Raja. He is the Get Us PPE co-founder as well as professor at the Harvard Medical School. It's good to have you here, Doctor. And when we talk about a commitment like this, 2 billion doses to countries that are less well off than the United States, it's a huge number, and yet it's not sufficient to inoculate the whole world. How does it help, though, to get us closer to that day?
Adam, it's a great point. It's a great first step. This pledge is exactly the kind of pledge that allows us to really operationalize the concept that we're not in this alone. What we all need to understand, and I think we're starting to really get there, is that as long as variants can develop in low and middle income countries with low vaccination rates, we're all around the world, we're all at risk of those variants coming to other countries and potentially causing surges. So this is absolutely and directionally the right move.
Doctor, today we have Rhode Island becoming the 8th state to reach that 70% threshold that we're trying to get to nationwide. The states that have been successful in doing this, is there anything that we can learn from their approach or their outreach programs or what they're doing that's so successful?
Sean, I think there's some great things that a lot of states here in New England, but states all over the country have been doing as well. And I think that one of the main things that Rhode Island had done before it announced that it was going to be removing most of the mandates is it got its vaccination rates up, and it got out there by going to the patients where they were, finding patients who were working class, who weren't able to take time off work and actually go to their homes and their local places of business and vaccinating them there. So being proactive about vaccinations is what allowed a state like Rhode Island to start opening up.
Doctor, when we hear that members of the CDC are raising concern that the new mask guidelines may actually increase the risk of spreading COVID at work or in public, should we look at that graphic that we just had up on the screen where states have already opened to show whether or not that's actually in fact the case? Because I'm thinking, for instance, Texas. I think a lot of people in Texas, it's understood, did not perhaps follow the mask protocols when they were in place that the CDC wanted. So could we use that to really find out where we're headed with the new guidelines?
I think we can, Adam. I'm from Texas, and I've got a lot of family and friends still in Texas. I think what we're going to see is that for those who are vaccinated, not wearing a mask, whether indoor or outdoor, is going to be perfectly safe. I'm obviously worried for the unvaccinated people who are indoors about the potential for spread. But as you said, we are going to see this play out over the next few weeks, whether we like it or not.
Doctor, when you take a look, I asked the doctor this yesterday, and I'm curious just to get your perspective on it. So it seems like things are trending at least in the right direction. Yes, we aren't at the goal numbers that we're trying to get to, but what's your biggest worry at this point into the pandemic as more and more states are lifting those restrictions?
Actually, Shauna, I'm not that worried about the summer. The states are generally in a good place, and we're all outdoors, and we are not in close and indoor environments. My worry is for the fall, when we start to see the usual cold and flu viruses pick up as people get inside and start huddling up, at least here in the Northeast. And I'm more worried about a surge in the fall, but I'm actually not that worried about the summer. I think that we're in a good place to open back up.
I wanted to ask you a question. It was the big headline yesterday about the necessity for a booster shot once you're vaccinated. Does the booster vaccine have to go through the same protocols to get approval, or is it a variant of the current vaccine, therefore it doesn't go through that kind of review?
You know, it's actually going to be a little different. The formulations are slightly different, and so they will likely need to go through the same sort of reviews. However, they should hopefully be able to get emergency use authorization as well.
All right. Dr. Ali Raja is the Get Us PPE co-founder and a professor at Harvard Medical School. We appreciate your being here.